Hi, so today our topic is about inflammation. We're going to talk about inflammation and mainly about the pathology of it. So we can start with a very simple definition. We can say that it's a vascular immune response in the connective tissue to the various injuries or injurious agents, to the various injurious agents that are both endogenic and exogenic. So this response, this vascular response or immune response, will be in connective tissue. It will be due to some factors that can happen. So we can have we can say this as causes of inflammation. What will lead to this vascular immune response or this body defense reaction that eliminates limits the spread of these injurious agents and helps to repair the necrosis and try to repair the damaged cell. So the causes, we can start with causes, and can be several ones. One is infective agents, and that is that can be microorganisms. Like as an example, we can say microorganisms, and you guys know that this might be bacteria, viruses, as well as parasites and fungi. So another cause of this can be physical agents. And these can be actually a lot of factors. We can have like mechanical trauma. We can start with mechanical trauma. Then we have a direct trauma that's happening to that part of the body. We can have heat, cold, and radiation. So these are some form of physical agent that can cause inflammation. Radiation. Another factor or another causative factor can be chemical agents. Some of the examples will be organic and inorganic poison. So organic / inorganic poison. So we have covered some of the causes. So we can have a reactive defense reaction in order to eliminate or limit the spread of injurious agents. This injurious agent can be due to microorganisms, bacteria, viruses, parasites, and fungi. It can be due to the physical agent, and that can be either mechanical trauma, or it can be heat, cold, or radiation. It can also be through chemical agent, such as organic and inorganic poison. We can also have immunological agents. We can have immunological agent. So these can be cell mediated and antigen antibody reactions. So we can have cell-mediated antigen/antibody reaction. I will write reaction as Rx. Another factor that we might have to include in our causes. Excuse my handwriting, it's a little bit of a mess, but we will try to get some room for the last one, and that will be inert agents, and that will be foreign body, for example, that enters our connective tissue or endothelials. So far so well. We know about what inflammation is, and we know the causes of inflammation. There can be several causes. Now we will talk about the classification or types of inflammation. So we can have, actually it is two types. We can have acute and chronic inflammation. So I will be talking mainly about the acute one, but some of the characteristics that differentiate these two types, it can be the onset. So acute is obviously it has a rapid onset, while for chronic inflammation there's a longer duration. It goes to delayed onset. We also have it's very short-lived for our acute, so it doesn't last very long. But this one, the duration is longer. Also, there we have a delayed onset for this one. So another factor is in acute inflammation, we usually have neutrophils as inflammatory cells. So we have neutrophils, while macrophages and monocytes are more common. Monocytes and macrophages. Are the inflammatory cells in here. So these are the inflammatory cells. And another thing is that the main characteristics for acute inflammation, which is a hallmark, and I will try to write it in another color, it is edema, which is a characteristic feature. It is a characteristic feature for acute inflammation, and this we will go in depth about what the mechanism behind it is and how it forms, how we have edema or swelling, in other words. While for the chronic one, we usually have granuloma formation, and that is the characteristic feature. So granuloma formation will be for the chronic inflammation. So talking about the types, now we're going to talk about acute inflammation, and it consists of 11 events, which the first 5 events are vascular, and the 6 other events are cellular. So this acute inflammation is divided into vascular events and cellular events. So here we have 5 steps or 5 events that are happening, and here we have 6. So together 11 steps, for acute inflammation. We start with vascular events. The first vascular event, so we start with inflammation. For example, we take any sort of microbe coming into our body, or maybe a foreign body, or we have an injury or a trauma. It can be due to anything like toxins entering. So I will try to draw a blood vessel. So here we have our blood vessel, and this is our normal blood vessel. And then here we have the injury that has occurred. So the first event that will happen when we have a trauma. So for example, there is an injury. We have vasoconstriction. And it will be a transient one, which means that it will last for a few seconds. So this vasoconstriction right here that you guys see, it's constricted, blood vessel is constricted, and we have a narrowing of the blood vessel that will last for a few seconds. And then after the injury that has happened, and we have a vasoconstriction transient and very fast and rapid happening, we will have a vasodilation as the second step. So first of all, this is a very common question, like in case of inflammation, acute inflammation, the first thing that happens is vasoconstriction. And after vasoconstriction, which lasts for a few seconds, we have persistent and progressive vasodilation, which means that the vasodilation will last longer and it is progressing. So it is not transient as the vasoconstriction that we had in the beginning. We have dilation of the blood vessel and it is progressive and persistent. So here we will see our vasodilation, which is, matter of fact, persistent, not transient, because the difference in here, you have to mention this because it's very important when you mention vasoconstriction and vasodilation, because our vasoconstriction is the first event happening in inflammation, in response to inflammation for an acute inflammation situation, while for the vasodilation, it is persistent and it is progressive. So this is the key main point between, and this is the main difference. We have vasoconstriction, vasodilation. One is transient, another one is persistent. So after knowing this, it gets easier, because right now we have done two events and we know what is happening in vascular events. So we have the first event, which is vasoconstriction, the second event, which is vasodilation. The third event that's happening will be increased hydrostatic pressure. So as you guys know, we have two kinds of pressure. We have one hydrostatic pressure and we have oncotic pressure. Hydrostatic pressure has got to do with blood. So we have water and blood, while oncotic pressure has got to do with proteins. So if we have a concentration of protein in one place, for example, here we have like proteins, and then here we have like less amount or less concentrated protein amount. So we have the oncotic pressure moving towards this one. So we have more oncotic pressure in here. Or for hydrostatic pressure, it's more about the pressure of the water, or where the water goes or takes place. So considering we have our hydrostatic pressure, this very factor will lead to edema. So we have had as we talked before, we have had our vasodilation. So we have vasodilation, which means we have more blood in this area. So if you have more blood, then there is more pressure. So that's a very common and very easy thing to understand, that we have vasodilation, which means there's more blood coming into that one region, and that leads to increased hydrostatic pressure. So that increased hydrostatic pressure will lead to edema. So this is why we have edema, swelling in other words, because the blood is coming, it is pushing or pressing through the endothelial walls of the blood cells, of the blood vessel, and that pushes through our skin as well, and that will lead to edema plus redness, or rubor as we say in Latin. Very important point that I forgot to mention before, which I can add in here because it's not late at all. We have 5 signs of 5 cardinal signs of inflammation, which these were discovered by a scientist called Celsus. The first one is rubor, which is, it doesn't have to be in order, so it is calor, rubor, tumor, and dolor. These 5 were discovered by, maybe I should leave some space for the meaning of these Latin words. It was identified by someone called Celsus, and then there was another one that is Virchow's. There's another function as well, so not function but a sign, function liaison, which in other words means loss of function, and that was found by Virchow. So this one was later added. So the first 5 signs of inflammation is rubor, which is redness. So we have redness, we have calor, which is heat, or warmth, that you feel warmth in that specific area of the injury. Tumor, which is swelling. Remember, it's not the English tumor, it's the Latin tumor, which means swelling. And dolor is pain. So these are the cardinal 5 cardinal signs of inflammation. And then we have also loss of function. So in here, the first vasoconstriction, we said that we have, it's very transient, very fast happening, and it only lasts for a few seconds. So for the second one, vasodilation, since we have the vessels dilating and pressing to the endothelial walls, and that too pressing into other vessels, so this will lead to edema, because there's a lot of hydrostatic pressure, and also redness. So we have we have tumor and rudor here as signs, and this will be due to the hydrostatic pressure. So if someone asks you, why do we have redness in an injured area or inflammatory area, then you will say it's due to the vasodilation. And I have explained why. So the 4th event that's happening, I just want to go through it again. The first event was vasoconstriction, transient, lasts for a few seconds. Second step is vasodilation, and that is persistent and progressive, lasts longer. And we have the third step was increased hydrostatic pressure, which will lead to edema. The 4th step will be increased So we will have increased vascular permeability. So this is a very important fact and a very important event, that there are some mechanisms. I will write this complete. So vascular permeability, and this does not just happen by itself, so we have to understand that why this is happening and the mechanisms behind this. So increased vascular permeability, there will be an altered permeability to the vascular system, and there are 4 reasons why this could be altered, or 5 events or 5 causes that will alter vascular permeability. So there are 5 causes that will alter vascular permeability. And I just want to say it from the very beginning, which will maybe help us later on, that we have edema in 3rd and 4th event happening. So we have swelling in 3rd and 4th event. But the difference between the edema is that this edema caused by the hydrostatic pressure is very different from the edema caused by the vascular permeability. The edema that will be caused by vascular permeability will be it will be an exudate edema, which means there is exudate. Okay, so the difference between the exudate, we will just take this like as a very fast, and I will erase it again because we are coming to this later on. We have exudate and transudate. Edema, so the difference is actually about the protein count. We have a very low to non-protein count in here, while in exudate we have a lot of protein, and this will be due to because we have an alteration in our vascular permeability, which means that it is more permeable. We are getting rid of a lot of things, and if our vessels are more permeable, then obviously we have a lot of white blood cells, red blood cells, and other things as along with proteins exiting our blood vessels, because we don't have the permeability that we had before. So the edema that was caused by hydrostatic pressure, it was mainly a transudate edema, which means it was just caused due to increased hydrostatic pressure and not due to vascular permeability. And it was just movement of it was vasodilation, and we had movement of blood. We had a lot of vasodilation here, so the blood moved out, and that was, our blood is mainly like, blood moves out, so water follows it. It was more of a transudate than it being protein based. So there is no protein that involved in edema when we increase our hydrostatic pressure. But if we increase our vascular permeability, then obviously there will be loss of proteins in that process, and that will be a exudate edema. So coming to the edema, we talked about it, that we have edema is happening both 3rd and 4th step, but the 3rd step, it will be transudate, low protein to non-protein concentration, while in the 4th event, vascular permeability, if we increase that, the edema is caused there as well, but it will be an exudate edema. So it is just like, excess fluid and interstitial tissue. That's what edema is. We have so we start with our increased vascular permeability, and there are 5 causes to that which alters this. normal permeability that we have in our blood vessels. First reason why it can be altered, it's due to the formation of endothelial gaps. So we say formation of endothelial gaps. I am attaching a picture in here. It's taken from the Robbins pathology book. So the gaps due to the endothelial contraction. So we said that we have a vasoconstriction, right? So if we take, if this is our blood vessel, okay, and we take a cross section of our blood vessel, this is how it's gonna look. So here we have one endothelial cell, and here we have another endothelial cell. So these ones, as you see, it's contracting. So the moment this one contracts for itself and this one contracts for itself, there are a lot of lines, so maybe it's hard for you guys to see. So if this one contracts for itself and the other one is contracting for itself, so obviously we will have a gap in here, and these gaps mostly it happens in venules, and it is a vasoactive mediator, and the main culprit or main reason for these gaps or contraction happening is actually histamine. It's very important to know the factors and what is causing these events or these alterations. So histamine is the cause for the endothelial contraction. It is the most common one. It is fast and short-lived, so minutes, we just, as we talked about the contractions. So this is one of the reasons, 1 out of 5, that increases vascular permeability. I will just denote it like this. And the second, so this one, if we just numerate it, that will be a good one. The second one will be due to direct injury. So direct injury of the endothelium. So this one is very easy. We have a direct injury to the endothelium, and that can be due to this injury that we have. It causes necrosis, and that necrosis, it's the attachment of the endothelial cells by toxins, and it can be due to infection or burns. It's just that we have necrosis and the attachment of the cells. So we can say due to toxins, infection, or burn, we will have necrosis, and that the attachment that injury will cause this injury. These will cause necrosis and the attachment of the endothelial cells. So we'll say it like this: of endothelial cells. So this is a pretty much like obvious reason or factor for why we have increased permeability. Another one can be leukocytes. The third one, it's leukocytes mediated endothelial cell injury. So this one, it is, if we have it, it happens commonly in venules and pulmonary and glomerular capillaries. So yeah, and it is just like we have leukocytes that want to escape or want to exit our blood vessels, and that is commonly, or most commonly, happening in venules. Another factor can be